The U.S. is about to face its toughest week in the fight against coronavirus. Cases are expected to peak here in Washington state and across the country. Health officials warned of an accelerating rate of cases and deaths. The U.S. right now has more than 330,000 confirmed cases and a death toll of more than 9,000. And here in Washington, the State Department of Health confirmed close to 8,000 coronavirus cases, including 338 deaths. Of the more than 87,000 people who have been tested, more than 91% have tested negative. While some areas of the country are getting worse, others are getting better. Tracy Potts has the latest.
I see light at the end of the tunnel.
With coronavirus cases expected to peak this week, the White House is hopeful.
We're also hopeful to see a stabilization of cases across these large metro areas where the outbreak began.
Washington state is giving away ventilators.
Because we acted relatively early.
In New York, most people hospitalized are going home.
The number of deaths over the past few days has been dropping for the first time.
But new hotspots are popping up in Illinois, Colorado, Pennsylvania, and Washington, D.C.
We are struggling to get it under control.
It's a critical week. Health experts are warning Americans to even avoid grocery stores and pharmacies. The federal government has millions of gloves and masks on the way. Democrats are pushing President Trump to appoint one person in charge of managing supplies.
A senior military officer, a czar, to be in charge of manufacturing and distribution and have the full authority of the president to send the materials where they're most needed.
The White House is reportedly considering it.
And President Trump says he's open to another relief package with money for infrastructure projects to get people back to work. Tracy Potts, NBC News.
General Motors will start making face masks today to help offset the shortage caused by coronavirus. The production line will be run out of an old GM transmission factory in Warren, Michigan. Once production's at full scale, GM says it will be able to make at least 50,000 masks a day.
Oh, wow. All right. Thank you, Mimi. You know, the CDC is now recommending that everyone wear sort of a cloth mask when they go out to run essential errands. And of course, King 5's MD Idrisi is live for us checking this out because we want to know how long COVID-19 can actually live on these cloth masks. Amity, what do you think? Do you think that we need to have multiple masks on hand because of the COVID-19 living on them?
You know, Michelle, actually, that's not a bad idea at all. You know, we first reported about the virus being able to live on surfaces for up to 72 hours. Now, when it comes to cloth, it doesn't live quite as long, but long enough for you to take it home from the grocery store, that's for sure. So we're referring to basically a study that came out just a few days ago in the Lancet, and it showed that the virus can live on cloth for up to a day. And I know you're wondering what kind of fabric. Well, the study did not specify, but we are comparing soft surfaces to hard here. The study also performed at the Public Health School in Hong Kong found that the virus can live on the outer layer of a surgical mask, forget this, up to 7 days. Now, it is important to note here that research shows that surgical masks are still more effective at blocking and filtering viruses than homemade masks. In fact, a study from Cambridge University in 2013 compared surgical masks to masks made from T-shirts. Researchers found that both were good at preventing people from spreading germs. However, the homemade masks were 3 times less effective in blocking bacteria. And a similar study in Vietnam showed that viruses got through cloth masks about 90% of the time. So this study, though, cited that the reuse of cloth masks could have increased infection. So the CDC on their website, they say that you should clean your face coverings frequently in the washing machine with hot water. A concern being brought up from the medical community right now is that people will have a false sense of security because of the masks, possibly making things worse.
You need to make sure you're not substituting social distancing with face masks, because the most important thing is still to stay away from people. Make sure if you put on a face mask, you don't touch your face and you don't and you wash your hands before you utilize it. And number 3.
Now, basically, the bottom line here is that if you do have a mask, make sure that it's covering tightly your nose and your mouth. But most important, it's basically going to protect you from me, Michelle. So that is the key. We're trying to slow and stop the spread. And of course, the best way to do that is still social distancing and good hand hygiene. Reporting live from Seattle, Amity Idrisi. Michelle, back to you.
Thank you so much, Amity. Great information. Certainly don't want people to have a false sense of security. In the meantime, you are looking live at CenturyLink Field, where crews are almost finished setting up a temporary Army hospital at the stadium's event center. The Department of Defense says the hospital is intended to help relieve some of the burden on the healthcare system, which could become overwhelmed. King 5's Sebastian Robertson explains.
The team store is boarded up, the streets surrounding CenturyLink Field virtually empty. Inside, soldiers of the 627th Hospital Center and 47th Combat Support Hospital are nearing completion of a mission usually reserved for wartime. This 148-bed facility will soon take non-coronavirus-related patients in an attempt to relieve efforts for local medical facilities. One of many measures underway in Western Washington.
And that's why we need places like this, to keep people out of the hospital if they don't absolutely have to be there, to make sure that the ventilators are available, that the beds and the doctors are available for the people who need that level of care.
Last week, King County officials took a tour of this medical facility, what they're calling an assessment and recovery site. A 140-patient facility spanning 2 buildings in Shoreline that, if activated, will screen and treat people suspected of carrying the virus.
It looks like we've avoided that exponential growth that should be happening right now in the number of infections. It is still growth every single day, and even at that rate that's not exponential, it can overwhelm the medical system.
Back at CenturyLink, 500 soldiers representing 3 posts are in position to set up and run this temporary field hospital. Extreme measures the Army and the county are ready to use in the fight against an invisible enemy. In Seattle, Sebastian Robertson, King 5 News.
This week is spring break for most Western Washington schools. While remote learning is on pause during the break, several school districts are still offering free meals. We know Beaufort School District in Lewis County, Lake Washington School District, Seattle Public Schools remind students that meals will be available all week long. Kent schools will also serve lunches Monday, Wednesday, and Friday this week. Mimi?
British Prime Minister Boris Johnson is in the hospital this morning. He was admitted yesterday after testing positive for coronavirus 10 days ago. The 55-year-old had been quarantined in his Downing Street residence since being diagnosed. British officials say Johnson remains in charge of the government and his hospitalization is only a precaution. His pregnant fiancée is also showing symptoms and is now in isolation. The Japanese prime minister is expected to declare a state of emergency for Tokyo and 6 other prefectures, but he says he will not close any cities. Public transportation and markets will also stay open, and officials are only asking the public to avoid crowded areas and close contact. Japan has been facing increased criticism over the way it's been handling the outbreak there. Take a look at this. The skies above Beijing are clearer because of the lockdown that lasted for months. The city's air pollution dropped by more than 40% in February compared to the same time last year. Experts credit the closure of factories and streets to stop the spread of the virus, but they warn that the smog will be back as Chinese factories ramp up again.